we don't expand our imagination.
Justification for being what you are.
Welcome to Washington Unplugged. I'm Bill Plante. President Obama says it's time to make a decision on health care reform. He rejected Republican calls to start over, made it clear that he's ready to do this without any Republican support, using a legislative tactic called reconciliation that requires only 51 votes in the Senate instead of a supermajority 60 votes, which of course the Democrats no longer have. Reconciliation can't be amended. But that, of course, means that the president needs Democrats more than ever, particularly in the House, where 39 members voted against the House health care bill, and where many Democrats really don't like the Senate bill. So joining me now are Democratic Congressmen Anthony Weiner of New York and Bart Stupak of Michigan. Gentlemen, welcome and thank you for being on. Let me ask each of you first, briefly, after hearing the president's speech yesterday, what did you take away from it? Mr. Weiner?
Well, I think finally the president's putting his finger on the scale. You know, no big national legislation ever happens without the forceful, outspoken leadership of the chief executive. And I think for too long he's kind of let the legislative sands shift themselves out. I think now that he said that he's prepared to fight for a specific set of agenda items that he has, whether I agree with everyone or not, really makes the chance of health care reform happening this year much more likely.
Okay, Mr. Stupak, what do you take away from it, for starters?
Well, I take it that the president is going to finally engage and will present a set of proposals. Not proposals, but actually written legislation. And when the president does that, it will carry much more weight than the Senate proposal that, or the Senate legislation that they passed on Christmas Eve. No one's willing to vote for that on the House side.
Okay, the White House is claiming that it has or will have the votes in the House to pass this. They're warning you Democrats who didn't vote for it, or who did vote for the original bill, rather, not to flip-flop, so that you don't get into a John Kerry position of being for it after you were against it, or against it after you were for it, saying that you'll get blamed by the Republicans for the vote no matter what you do. Is that a persuasive argument?
Well, look, I would tell the president to leave it to us to do the politics for what we think is right, because this is really about the substance of the bill. I think the president is right to give us his proposals. They are not etched in stone. This is now, frankly, a more traditional legislative process. The president, for example, left out the public option, something that the Senate, that Tom Harkin says they have 55 votes for in the Senate. We passed in the House, and 70% of the American people say they support. Not everything that the president wants he's going to get, but he's absolutely right that now is the time for us all to stand up and say, listen, we're trying to do something that's going to benefit America today and for the generations to come. This is very important stuff.
You both, though, have views on what should or should not be in the bill. Congressman Stupak, you definitely are concerned about the abortion conditions in the Senate bill.
Correct, and we want the president just to keep current law. It's been around for 33 years, which basically says no public funding for abortion. I hope the president puts it in. I hope it's part of his proposal. It'll be easier for me then to support. You know, most of us we had 220 votes in the House, so all of us who voted for it once are willing to vote for it again. But, you know, as Anthony said, there will be some give and take on the president's part if he plans on getting this bill through the House.
Well, Congressman Weiner, you've said that some of the Republican ideas are unsalvageable. And of course, as you just mentioned, you're a supporter of the public option. What will it take to get you on board?
Well, look, the problem is that there are accommodations that are going to have to be made for people who want some things out of the bill that I want in the bill. But that's just legislating. But I am in the camp that says don't let the perfect be the enemy of the good. I've compromised a very long way here. I supported originally a Medicare for all proposal, single-payer system, simple, easy to understand. I compromised for a strong public option and compromised again for a weaker public option. So all of us have to have the understanding we're not going to get everything we want in this bill, but we should want the basic elements, and that is expanded health care coverage to reduce the cost for all of us.
Well, Congressman Stupak, are you also not going to let the perfect be the enemy of the good? You've been quoted as saying there's no way that you'll vote for this unless the abortion restrictions can remain.
Correct. I mean, I heard the president say when he addressed the nation on September 9th, there'd be no federal dollars for abortion. We're going to honor that pledge, and as long as he has no federal dollars for abortion, we're in pretty good shape. You know, Congressman Weiner and I both sit on the Energy and Commerce Committee. We've sat there for a couple of weeks and marked up this bill. We had a full process. Republicans joined us in that process. and now the president is putting forth his proposal. Let's get a bill passed. I think we both want to see affordable, safe health care for all Americans.
Okay, it's pretty clear that there's nothing going to pass without using the tactic known as reconciliation. And that means that you guys have to vote for the Senate bill and along with that, vote for some changes. Are you comfortable with that?
Well, look, fool me once, shame on me. Fool me 290 times, shame on you. That's how many bills the House has passed and the Senate has still left untouched. You know, Benjamin Franklin called the Senate the cooling saucer of our democracy. It's like a meat locker over there. So asking the House to do something on spec is really not the right order to do things. The United States Senate has been the single problem with getting this bill passed. They have been for months. The Gang of Six, Olympia Snow, Joe Lieberman and his multiple personalities. Now it's time for us to finally get them to do something. And the order should be they should fix their bill with a majority rule process, and then we'll adopt it if it turns out to be up to the standards of the American people.
Okay, so we got a process problem here. Is that right, Congressman Stupak?
Not necessarily. I was just talking with some of the leadership folks here earlier this morning at the Energy and Commerce Committee, and we don't necessarily have to vote on the Senate bill. As Anthony said, I don't think they have 10 votes for the Senate bill, but during the reconciliation process, this is where the president can put his proposal or a single payer, whatever the president's going to put forth, and that we can make that part of reconciliation, and that would be the vehicle we would use. The word is called reconciliation, but we're just finding a way where we can get through the Senate hurdles and a simple majority and pass health care legislation.
So bottom line, you both want to wait to see what the legislative language is, right?
Oh, absolutely.
Yeah, I've kind of got a weakness for words and numbers and pages around here.
All right, Congressman Weiner, look, you know New York politics, so given what's going on with Congressman Rangel and Governor Patterson, what's your take on the state of politics in the Big Apple?
Oh, look at the time. I got to get going, Bill. I'm not sure. Look, the fact of the matter is this has not been a happy time in New York politics. You know, there are so many challenges that are so enormous. To have a governor going through the challenges that he is, and these are very serious charges, so serious in fact that if they turn out to be true, I don't know how he can continue to govern. What happened with Charlie Rangel, I mean, it's nothing short of a tragic situation. I mean, this is someone who served his country in wartime, served this House remarkably well, and served New York beyond any call. But he is right that his investigations that were going on were creating a distraction for us. And once again, he put his own career aside on the benefit of trying to get something like health care done. And hopefully, you know, when I come on with you again, these waters will have been settled and we're back to the questions of governance.
Well, I want to thank you both very much for joining us today on Washington Unplugged. And back on health care, we'll just note that the president is already pushing hard. He's meeting today with the chairs and co-chairs of various House caucuses. Next week, he'll visit Pennsylvania and Missouri to campaign for health care. It's no accident that both states have Democrats who voted against the bill, and he hopes he can change that. Thanks for watching Washington Unplugged. We invite you to join us again tomorrow on CBSNews.com. I'm Bill Plante. Have a great day.
We don't expand our imagination.
Justification for being what you